The estimator tool should be used to determine the expected reimbursement amount allowed by insurance carriers on services a patient has had in your office, as well as to calculate the patient responsibility portion of the reimbursement so that you can collect it up front. The payment amounts calculated by the tool are only estimates and could change after the insurance company has processed a patient's claims. To use the estimator tool, type in the patient account number and select their insurance company from the payer drop-down. Enter the patient's remaining deductible and coinsurance as identified from their insurance verification. You can verify the patient's insurance by using online eligibility tools or by calling the insurance company. Next, enter all of the patient's CPT codes as identified on the encounter form. If a 26 or TC modifier would be applicable, enter this using a dash between the CPT and the modifier. Do not enter any other modifiers in this manner. Finally, update the unit amount to reflect the correct number of units for the patient services. If a 50 modifier would be applicable, indicate this by entering a 1.5 unit amount for all carriers. The expected reimbursement amount from the patient's visit will calculate for you, and the patient's portion of that responsibility will be shown under the Collect from Patient field at the bottom of the screen. Collect this amount up front when the patient is at your office and enter it in clinics using the EST pay code. Finally, you can print a copy of this estimate for your records or for the patient by going to File, Print, or by hitting Control-P on your keyboard. When you are done, close the estimator tool without saving changes.